Excuse me, ladies and gentlemen. Thank you for your patience in holding. We now have your presenters in conference. Please be aware each of your lines is in a listen-only mode. You may submit your questions electronically anytime by using the Q&A pod located to the left of your webinar platform. You may also download a copy of today's presentation using the resources pod located directly below the Q&A pod. It is now my pleasure to introduce today's first presenter, AHA moderator Kayla Hayward. You may begin.
Thank you. Welcome everyone to today's webinar. This is Kayla Hayward with the American Hospital Association, and I'm pleased to introduce today's webinar, From Data to Impact, Measuring Success when Integrating Social Care into Healthcare. Today's event is sponsored by Unite Us. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We like this session to be interactive, so we are looking forward to hearing your questions. If at any time you have trouble with audio, please try refreshing your browser. You may also submit any technical questions into the Q&A box. At this time, I'd like to thank today's webinar sponsor, Unite Us. In today's webinar, we'll explore ways to track social care initiatives and measure impact effectively across the health system. We'll also hear real-world examples and strategies on how to ensure successful implementation and adoption of social care workflows. At this time, I'm pleased to turn the presentation over to our moderator for today, Amanda Terry. Welcome, Amanda.
Hi, thank you so much, Kayla. Thank you so much to everyone for being here today. My name is Amanda Terry, and I serve as the Senior Director of Research and Evaluation at Unite Us. I'd love to start by introducing our amazing panelists from Sarasota Memorial Healthcare System, based in Sarasota, Florida. We have Dr. Pam Beitlich, former Executive Director of Sarasota Memorial's Women and Children's Services, and current Sarasota County Public Hospital Board member. Mary O'Connor is our Manager of Healthcare Equity for Sarasota Memorial, and Dr. Chelsea Arnold, First 1000 Days Suncoast Initiative Manager. Sarasota Memorial has been working with Unite Us since 2020 when they implemented our tools as part of their Social Drivers of Health strategy for their women's and children's services and to support the First 1000 Days Suncoast Community Initiative. So to kick us off, Pam, could you please tell us more about Sarasota Memorial's role as a public community hospital, how that drove their commitment to the community, to the work of First 1000 Days specifically, and just in general, the strategic priority to address health equity across the region?
Yes, absolutely. Love to. And thank you for having us today. We're very excited to be here. We get very passionate about talking regarding this work. So just as an organizational overview, Sarasota Memorial is now a system of 2 hospitals, and we're about to build a third one in Northport in our South County. We now have 1,075 beds total and almost 11,000 employees, almost 5,000 babies delivered annually. We have about 175,000 ER visits. We have three ERs at this point, and we're about to build a fourth one. We have been around. Next year it'll be 100 years. We are a public, not-for-profit organization that has 9 elected board members, if you can imagine. We just finished up an election last week, as I'm pretty sure everybody on here knows. And yes, I am now, after retiring from Sarasota Memorial in May, after 43 years. I was 10 when I started working there, but after 43 years, I'm now, I wanted to kind of put my hat in for something different, to serve the hospital and the community in a strategic fashion. So I am the one of 4 of the latest members just being elected. A couple of other things around us, um, or about us. I think one of the things I'd like to say today is please, in the words of Quinn Studer, relate, don't compare as we talk about who we are. I know a lot of you are certainly, we've got some for profits. We have a lot of different people on this call that have maybe a different mission and vision than we do. But I'm going to speak kind of generically where I think we all are from a 30,000-foot view as hospitals of looking out into our community. How are we going to better serve our patients? I would say 10 years ago, that wasn't really high on our priority list. It is now. It's very high. And really what happened with us is our mission is very much to serve the underserved. We serve everyone from Longboat Key to Casey Key, millionaires that live here to those that have absolutely no insurance or underinsured. Our scope is very, very broad. We have everything from women and children's, a level 3 NICU, all the way to oncology. We have a huge cancer institute. We have a very large heart program, rehab. I mean, just about anything. We really are a broad scope of services. So again, as we try to keep up with the growth in our community, which I'm sure a lot of you can also relate to that, we're just trying to meet the needs of our patients the very best we can. A couple of things, though, as we walk through this morning or this afternoon. It is 1 o'clock, isn't it? Sarasota Memorial is a healthcare system. In my opinion, we have a lot of pieces that make up the system. And one of them is women and children's. And as you just heard, that I was the executive director for a number of years. And we really tried to do a much better job of looking at partnerships in the community. And as that became more and more apparent that we weren't really giving our moms and babies everything they needed when they left, which is a really big, a really big ask. We looked at how can we partner with nonprofits in the community? How can we bring philanthropy and nonprofits together? And what happened out of all of that, and it wasn't because we thought of it, we had one of our very unique foundations in the community, the Barancic Foundation, literally came to us and me as the representative of SMH of what can we do to really pull all of our resources together. From all of that, we birthed, we call it First 1,000 Days. We started small, and you'll hear a lot more about this, just Sarasota County, but it's now First 1,000 Days Suncoast. As we found there was a tremendous need for linking the community with our moms and babies. That started in 2018. We added one FTE. So here I am talking as the executive already. Oh, wait, what's this going to cost us? And it was one of the best hires I always say we ever made, Dr. Chelsea Arnold, as overseeing the whole entire initiative. What she and Mary have been able to do, I take no credit for that, is pretty amazing. You're going to hear some of that, some of the results. One of the things, though, that we found pretty early on was that we are kind of still living in the dark ages of being able to hook up our patients with community partners. And when we came upon something called Unite Us, this electronic platform, it really, in my opinion, was a game changer. Actually, our partners in the community have called it the very same thing. One of the things I always like to say is when you start something that has anything to do with patient data, everyone kind of freaks out over HIPAA and everything that you're going to about what you're going to be doing with their patients and their data. I always like to say that when we started looking at Unite Us, we really did a colonoscopy, if you will, and our legal department, wow, were they very thorough in making sure that we should be part of such a platform. As we talked with First 1,000 Days and with all of our partners, we came up with a community model that Sarasota Memorial would be the backbone organization. And that was mainly because, again, next year we'll have been here 100 years. We're probably not going anywhere. And, often some nonprofits, depending on their funding, et cetera, can not be quite as stable as we are. So as the backbone organization, we took a tremendous interest, a lot of, I'll just say, passion in this whole initiative. As First 1,000 Days grew, and you're going to, again, see some of that, we then said, gosh, it shouldn't just be this availability of Unite Us for social determinants with just our women and children. And shouldn't we scale this to the entire organization? And part of my job as the executive was to make sure that I had partnerships inside the hospital, inside the healthcare system, to really, I'll just say, pull the decision makers in and make sure that we had people that could decide whether or not it was something we wanted to take to the entire organization. We can talk about that a little bit more as far as partnerships, but I think it's key to say you have to have internal partners and external partners. So as we rolled this out from First 1,000 Days, I pulled in obviously the C-suite. So all those people at the top of your organization that are leading really had to come into the conversation, really had to look at, well, is this really worth, what we're trying to accomplish? We are very much an organization that starts with, is this the right thing to do? But I'm also extremely aware that you have to be able to connect, again, the right people to it, and really look at what's the long-term investment. So that was my role to play as the executive, to kind of link up the community as well as the C-suite inside the system. Unite Us is something that, again, you're going to hear some results here that have been nothing, in my opinion, short of astounding of how much progress we've been able to make. So enough about that as just kind of the overview. Where I'd also like to go just for a moment, if you can take us to the next slide. I'm going to hand it off to Chelsea, because out of those partnerships that we had with the community, we had no idea there were this many people serving moms and babies in the community. So to make a real, I'll just say, make some sense out of all of that, Chelsea is absolutely the one that assisted us or led that coordinated system of care. So Chelsea, tell them how you did this.
Thank you so much, Pam. I appreciate it. And I will share that without the leadership of Pam driving this work, really none of this would be possible. And then I also have to share, same with Mary O'Connor sitting with me here today. Having champions in this work is really key to making it all possible. As Pam mentioned, First 1,000 Days Suncoast is a tri-county initiative, and we are now comprised of over 90 partner organizations, all working to move from what you see on there, a maze of resources, to a coordinated system of care to improve the health and well-being of children and families. And we do that utilizing the Unite Us network, and also having strong support of Sarasota Memorial as the backbone organization. One thing that I will say is that Sarasota Memorial really helped us ignite a movement across the entire region to screen and refer families for services, creating a no wrong door approach to care. So no matter where families went, they could get the services that they need. And we were really able to do that using the tool, which is Unite Us. I really believe that healthcare systems have the responsibility, but also the trust of their communities to be at the heart of community initiatives, to be the backbone of many different projects. We have so many passionate professionals, a lot of expertise, and we're all just working to improve the health of our communities. And I will say that I feel really proud and honored to work in a healthcare system that has made this a priority. And I look forward to the future of healthcare, the future in our community, but also the way that it's moving and what the rest of the nation will be doing.
Thank you so much, Chelsea and Pam, both of you, for that fantastic overview of Sarasota Memorial's role in both supporting this critical community infrastructure and those community connections. We're always really thrilled to spotlight the important work for First 1,000 Days. And as you mentioned, Pam, beyond operating as the backbone organization for First 1,000 Days, Sarasota Memorial also implemented Unite Us in their Women and Children's Services in 2020 with the goal of connecting new parents to resources during their hospital stay or briefly after their discharge from their hospital with their newborn. Mary, could you talk a little bit about how Sarasota Memorial arrived at the decision to implement Unite Us as part of your SDOH strategy, some of the factors informing that specific focus on the maternal health population?
Sure. Thank you, Amanda. So we knew from, working here in the hospital, the staff feel the burden of their patients' social determinants of health needs, and nurses often already know when their patient is homeless or that they're struggling for basic needs, and getting those patients connected to community resources is really important. If a nurse or a case manager can't get that done efficiently or effectively or timely, as you know, it's a big problem for that daily hospital workflow. And previously, our staff spent time at the fax machine, spent time keeping updated resource directories, printing contact information, keeping flyers for community organizations and giving them to patients, hoping then that the patient will follow up later upon discharge. In fact, just like this flag says, we send them home on a hope and a prayer. But our hospital executives recognize the value that Unite Us brings for our patients, our staff, and community. And it really, as Pam had said, this has been a game changer for us and has given us tremendous power to do this work to reduce, healthcare disparities. So it's what we've found in using this in the hospital, that it saves our social workers time. It gives them an always up-to-date resource directory. And with the patient's permission, we send referrals on their behalf directly to community partners. And those community partners then reach back out to the patient. And that's, relieving the burden of that job to do for the patient upon discharge when they're managing so many things, complex with their healthcare, and in women's and children's, obviously, going home postpartum and with a baby. The Unite Us platform additionally gives us incredible data that was before hidden from us. The Unite Us data tracks not only just the number of clients or patients that we're connecting to care, but also the number of referrals, the referral volume by what kind of needs the patients had, whether there are reoccurring needs. It also allows us to follow whether the patient's needs were resolved or they were still unresolved. It helps us follow our top receiving organizations in the community and also rejection rates. So we use this data that we have from Unite Us to drive our community work and to know where we can be most effective in improving some relationships or workflows in the community. And Chelsea will talk more about that in a little while. But also, our feedback from our employees has been that they feel more confident speaking with patients about their needs because they have a way to connect the patients to the community agencies that they need. In our OB services, we do follow-up phone calls for patients, and those nurses who conduct those follow-up phone calls have access to Unite Us. So previously, before having access to Unite Us, as I imagine many of you might know, if you've ever been on the phone with a patient who's been discharged from the hospital or at an office situation, and they divulge some need that they have, you feel a lot of anxiety around that because you have no way really to help them. So now with the power of the Unite Us platform, our nurses who do those follow-up calls now confidently screen for social determinants of health even after they've just left the hospital, because new needs are always identified after discharge. They can ask those questions with confidence because they know, wait, I can connect you to services right here with your permission. And on our very first day of using Unite Us, way back that many years ago, we began screening patients in our OB emergency care center. And we didn't know what to expect because we had never screened for social determinants of health in that outpatient population. But on that first day, we found several mothers that needed to be connected to services. And we found one mother that was particularly in need. We sent 7 referrals for her. She needed childcare, she needed food assistance, she needed counseling services. And we can see on the Unite Us platform that within 24 hours, several agencies were already reaching out to help her. Thank you.
That's great. Thank you so much, Mary. Always just nice to hear, those stories, because at the end of the day, we're all here to connect patients to the care that they need. So as part of all of that great work that Sarasota Memorial has done, implementing social care referral workflows, we did recently complete a collaborative evaluation in order to demonstrate the impact of social care referrals on postpartum healthcare utilization. And we found that for Sarasota Memorial patients with Medicaid, the likelihood of postpartum 30-day readmissions were reduced by 59% for the parents who had a social care referral when compared with those who received usual care prior to Unite Us being implemented. So those results are really exciting. They speak to the importance of the healthcare system's role in addressing whole person health. And yet, clearly that takes time, right, to get to results like that. We implemented in 2020. This is now 2024. So Pam, my question to you is, can you just share from your approach as an executive, how you make the case for this type of long-term SDOH investment when we don't necessarily see those returns right away?
That's a great question. And I love this quote from Don Berwick of "Not a smart investment to keep running healthcare as a repair shop." It's so, so, so true. I was actually one of those nurses. You saw that quote earlier. I started at Sarasota Memorial as a cardiac nurse and down in the ER. And I just remember discharging patients. They were on 10 medications. And you could see the look of almost fear in their families' eyes of, I literally would say, good luck. I hope you make it there at home. We all know that, medication errors, all kinds of things that can happen once you discharge a patient. And on a personal note, and I think we'd all also agree that healthcare is extremely personal. And I think that's where you have to connect everybody that's going to have a part of this in terms of, again, making this long-term investment. The results don't happen overnight, but you absolutely have to get to results to be able to, I don't want to use a word, but sell this as an investment. I have 94-year-old parents that live 8 minutes from my house. And now that I'm retired, I'm there even more. But I really marvel at the fact of all the care that goes into, their health, making appointments, understanding what to do, what not to do, what to eat, etc. And I'm very lucky. They're still at home, pretty independent. But they have said this 1,000 times. They have no idea what they do without, somebody that knows healthcare, i.e., a daughter. Of course, I have 3 brothers, so guess who's in charge of most of this? But anyway, it is very true, though. I think healthcare today, if you don't have family members or you don't have access to much of a support system, you can almost see who's going to be coming back in or readmitted for, something that was probably very minor, but they really didn't know how to navigate it. I mean, things like with my parents, a fall can set them back for, weeks. They'll be back in the hospital with some kind of long-term hospitalization. So I've seen that over and over. And I also have a sibling that has, is going through a lot of things today around mental health, things that are happening to him. And that whole piece of healthcare alone is, I'll just say frightening, really, in terms of the long-term kind of ripple effects of what we can see. We look a lot at, I don't know if y'all are familiar with ACE, adverse childhood events, or things that can happen to us when we're younger. But all of that rolls into how you age, what your health is, and how do we really start to become involved with, I can't say it any other way, but a long-term investment into our patients. It behooves all of us, even though we are the acute care part of healthcare, if you're in a hospital setting. One of the ways that I think we did this pretty well was to, again, I already talked about who our C-suite is. And I think you have to really know who are the major influencers, let's put it that way. And one of ours is our chief legal officer, Carol Ann Kalish, who we involved her from the very beginning. We had a big presentation to C-suite and really went back to the heart and soul of what healthcare is, connected them to some stories that Unitas helped us with to explain. When we first started talking with Unitas, I was caught in almost immediately to some of the stories that they connected us with. I think you have to do that over and over. Why did Unitas even start? The beginnings of it. All of that to me was extremely important. It was also really important to me to see some of the organizations and systems that were already using Unitas as a platform. We like to say at SMH that we benchmark and we're always ahead of the game. I don't know that we always are, but I can tell you once we see something that we need to do, we're pretty much early adopters. And I think that's, again, you've got to figure out who are going to be the ones that can help me influence to make this long-term investment. And I don't think that there's any going back for us now, just because we've seen the power of what this electronic platform can do. As you heard Mary say, gone are the days when we had these notebooks of who's in the community and somebody had to update them and you had the wrong phone number and all of those things that made your staff crazy. And now you've got this quick, easy way of hooking them up with somebody in the community. I mean, I certainly didn't know people from the food bank before, and now they're one of our biggest partners. Those simple, basic things with food, housing. Again, we're not in the housing business, but we can certainly connect you now with, next steps and what you need to do. If a woman that just had a baby is homeless, if you don't think that's going to impact her care as well as that baby, there's no way we can, I guess, kind of turn away from it anymore in healthcare. I think we all knew this 10, 15 years ago, but we're finally at that point where we're all seeing it in healthcare of how important social determinants really are. So I guess to answer, I would look for those that can really connect with the heart and soul, the influencers. And as I said, if you don't have data, it could feel good, but you're going to have to show me some data that this is worth it. And again, Unite Us has so much data that it helped our partners in the community, our philanthropy partners. They're always looking for, if we're going to invest in this, how do we know we're really going to be spending our money wisely? So you can never, ever get away from that.
Yeah, no, such an important point, Pam. And also just thank you for the reminder of really the complexities involved with both patient care and then doing this. We might call it extra work. It's not extra work. We know that it's all part of patient care. But as you mentioned, really, it's just been within the last 10, 15 years that social care has gradually been integrated into healthcare in terms of like the industry movement, right? Those of us involved in public health have sort of always thought of it that way. But yeah, really appreciate all of those different perspectives and the idea that, we are all coming from diverse partners, organizations, and yet what we're trying to achieve is the same thing, and bringing it back again to making sure that patients get connected to all the services that they need, including those community-based services. And so kind of circling back, I guess, around to, again, this idea of focusing on those strong community partnerships, building consensus across stakeholders. We know that in and of itself takes a lot of work and effort. And so, Chelsea, because you've done so much of that through First 1000 Days, I was hoping you might be able to talk through the steps, that you all took to ensure that voices, lived experiences of the community were effectively integrated into your program's design, execution, evaluation efforts. I know when we attend conferences, this is the piece that people are talking about a lot, is how do we get a community involved and how do we make those connections specifically? So I'll turn it over to you to talk a little bit more about that.
So much, Amanda. I think what is helpful is walking through a little bit of the history of First 1000 Days and really all of the different steps that we took to get where we're at today. I will share that one of the key pieces of the initiative, and I think what has made us so successful, is the flexibility, the nimble nature of moving with the needs of the community, listening to the community, and making sure that we're building something that's going to be effective and sustainable. And without the lived experience from not only parents in the community, but also professionals, there's no way we're going to be able to create something that works. And our first step was really in 2017, the Charles and Marjorie Barancik Foundation, Sarasota Memorial, and a couple other partners came together and said, we really need to improve coordination for families in the community. Building on that, in 2018, it launched, and 32 partner organizations came together to build a shared mission and vision, which really energized the community about this work. After Sarasota Memorial was designated the backbone organization, I was hired into my role to really help with the operations and the strategy of the work. And this first piece that was so critical was building those partnerships, those authentic community connections with professionals, with parents, with executives, but also the people that work directly with the families. And that really helped lead me into the next step, which was a full landscape assessment. I pulled data from the healthcare system, worked with IT to develop a dashboard to look at that information, the risk factors we were seeing for families, pulled our local Department of Health data, worked closely with their team members to look at ways we could better support families. But I think the biggest piece was that lived experience. We did parent focus groups across the community, speaking with over 100 parents. What are those barriers? What are they seeing in the community? And I remember Mary and I went to a conference and someone said, why are you not getting the voice of the consumer? Apple makes sure that people test out their products or give feedback. You need to always get feedback from the people that are using your services. And that is something we have done ever since. Parents are deeply embedded in our work. And so after our landscape assessment, build our strategic plan, again, using parents and professionals, all the information we gathered. And care coordination was a key piece of that strategic plan, since we knew difficulty navigating services was a top barrier. Unite Us, again, came into play. We got consensus from numerous nonprofit organizations in selecting this platform. It was not just the healthcare system. We had buy-in from key stakeholders. And I really believe that because we had that shared mission and that collective work that we were doing together, that everybody was excited and so energized about the system. And that's what made our launch so successful. Once we had that technology, we were able to operationalize our 3 key components: care coordination, parent empowerment, and targeted interventions. Along the way, those targeted interventions came about because we looked at the Unite Us data. We looked at any race or place-based inequities, any service gaps, barriers to care, but we married it together with the voices of people who had lived experience, those real stories, to come up with tangible solutions with our partner agencies. And I think that's really, again, the beauty of our work, is the partnerships and the creativity that comes from data. And last, we just completed our second strategic plan, again, doing the same landscape assessment, but looking at our tri-county area. We are going to be following the same 3 key components, but I am really excited that we have the structure put in place. We have the partnerships, and now it's really just continuing to expand on our work.
Thank you so much, Chelsea. And so on the other side of the lens, we've just been focusing on the community side, but on the other side of the lens, Mary, your experience with integrating universal SDOH screening and referrals, particularly in OBGYN settings, and then now across the entire healthcare system, has really also been pivotal for the success of this program. So my question to you is, what advice or lessons learned do you have for healthcare systems that are looking to embed this type of health equity more strategically into their day-to-day operations?
Well, starting a project as large as this requires, like we've talked about, key champions for the work. We, under the direction of our hospital leadership in 2021, we pulled together a social determinants of health committee at the system level. So we started to look at how we can serve our patients better and how can we reduce disparities. And through that committee, we brought together physicians and nurses. We brought together a multidisciplinary group. We brought in coding and quality so that everybody's got a voice at the table. And the buy-in is critical, of course. So, the executive leadership, we know that, under their direction, we started that committee. So we knew we've got the buy-in for it. And then as we continued the work, and we found that CMS and Joint Commission were now coming out with new regulations for screening and addressing social determinants of health, we knew that it just confirmed our core belief that we were already on the right track with the work that we were doing, and it just gave us some extra momentum. But since CMS was requiring that all inpatients who are over 18 be screened for social determinants of health, through our committee, we started to figure out what's the best way to ensure that every single patient is screened. So we looked at all possible workflows to meet that directive, and we decided upon the bedside nurses doing the screening. We know that the benefit of having the most trusted profession, which is nursing, asking those screening questions would give us the best opportunity for patients to reveal their struggles. We remember that nurses are really attuned to their patients' needs, and they know if they're struggling, so that in this nurse-patient relationship, they can have the ability over time to build that trust. And the nurses adding those structured questions into the nursing assessment really didn't, I don't want to say added too much to their plate, but really it was that work was already there, and now we just kind of structured it and built a workflow around it. So once the nurses do the screening at every admission, it's built into our system for an automatic case management consult to be generated for anybody that has identified needs. So our case managers come to the patient's room and do a full social, assessment, and then, dive in deeper for any of the additional needs that those patients will have. Once they find a social need or behavioral health or something that the patients need, they use the Unitas platform then to make those referrals for their patients. Our impact evaluation with Unitas showed that 79% of the cases that were referred were accepted by community-based organizations, and 63% of them were successfully resolved. The other lessons that we learned, was to make sure to obviously work with your coding team very closely, work with IT team very closely, and we've really worked hard to do that. We found in retrospect that the coding team loves the new social screenings because all that information is in one place and easy for them to find. So that's helped them be more effective and efficient. And then, of course, with our IT team, we worked hard to make sure to have the data requirements in mind when we were building those, so that we can more easily make sure that we're capturing that required data out of the electronic health system.
Yes, thank you. So amazing to hear about just all the details that go into planning this type of workflow. And I think it really important for folks to be able to hear sort of the nuts and bolts of how this actually gets done in your day-to-day operations. So thank you so much, Mary, for sharing. We just heard a few additional results and outcomes in terms of, numbers of folks actually having a resolved outcome, for example, for those who do get referred. And we heard a little bit earlier about some of our impact evaluation results with reduced healthcare utilization. But I want to give a moment to Dr. Arnold to talk a little bit about some outcomes that we've also been seeing with the first 1,000 Days Suncoast initiative and some of our evaluation results there.
Thank you so much, Amanda. One of our most successful programs that we implemented utilizing Unite Us was our family navigation program. And with difficulty navigating the system being that top barrier that was identified in the community, we knew we needed to do something better to support these families. We have 2 family navigators. One is a previous NICU nurse, and another is a case manager with extensive experience in women and children's. And they are the front line that answer incoming community requests for anyone who is pregnant, postpartum, or has a child that's under the age of 3. We primarily get people that come through our paid social media ads. These are people that don't know where to start and how to get the help that they need. And through our family navigation program, we have seen a statistically significant reduction in perceived stress for parents. 30 days after assistance, it dropped down to 43%. And then 60 days after assistance dropped even further to 54%. We use the Unite Us platform to refer families for services. So I just have to point out the strength of our partners and all of those supports that they provide families. We are the warm start and the connectors for these families, but our partners are the ones that are providing the services. And so it really speaks to the strength of the system that we're using, our navigation program, Unite Us, but also our partner organizations. We also saw a reduction in reported unhealthy mental health days. We saw an increase in protective factors, such as improved social support and concrete support. And both of those have been linked to a reduction in child welfare involvement in previous research. And so we know by supporting these families, we're reducing that potential. Other things, in addition to our family navigation program, are our perinatal mental health coordination hub. We partnered with 10 different mental health agencies, nonprofit organizations to develop this hub where anyone who's struggling with any mental health concerns during pregnancy and postpartum can reach out to our family navigators. We also partnered with Healthy Start Coalition of Sarasota County to respond to these requests, and we connect them with those mental health services. This has been a really exciting targeted intervention. I know that I mentioned it before. Looking at the data, hearing the stories of families, understanding that maternal health is a crisis and we needed to do something about it. We listened to them and we were able to create this program, which we're still working very hard on. We did a huge social media campaign, again, incorporating the lived experience of parents in the community, having them create those paid ads with us so that we knew it would be something that resonated with them. A few other things just really quickly, I know we're getting close to the time period, is we also support professionals in the community. We have navigator work groups where case managers and nurses, peer support specialists, anyone that touches the lives of families comes to these navigator work groups where our goal is to improve knowledge of community resources, build that peer support, and also to reduce compassion fatigue, since we know that is a real issue in the community. And we have developed numerous targeted interventions by using the data and parents, a diaper wipe drive because it was a top need identified on Unite Us. We got swim lessons donated by a local business here to address a need that we found in our parent focus groups. We have implemented a text messaging service because unable to contact clients was a top need or a top reason for unresolved cases on Unite Us. And we knew that we needed to better communicate with our patients. The Barancic Foundation supported us with that. And again, going back to what Pam said, bringing the data and bringing these ideas to local foundations or applying to different grants has really supported some of the exciting interventions that we have been able to create. We have a lot of different things that we've done, and so I welcome any of you to reach out to learn more, or you are free to go to our website, and I believe that's at the end of the presentation.
Thank you so much, Chelsea. It's so inspiring to hear about sort of the evolution of how these programs have been iterated upon, have continued to improve, and will continue to grow and expand. So thank you to all of you for being here and for sharing. I had one more quick question that I'm hoping we can just maybe briefly go around the room and respond to, and then we can get to some of the audience questions. But final question to all the panelists is just, what are some future trends or work in this space that excites you or inspires you the most? What's next for Sarasota Memorial? Mary, I can start with you, and then you can pass it along.
Thank you, Amanda. Next on our sites is to start working more fully on our outpatient areas and developing screening and addressing the social determinants of health workflows in those areas. We've already started piloting that in some of our physician offices, and it's going really very well. So we're excited about looking forward to that. We are also going to continue to work on strengthening our partnerships in the community, expanding to folks who are not yet using the Unitas platform, because all of the screening and connecting people needs to have somebody to receive those referrals. And with the relationships that we build, we'll be able to ensure that people can get their needs met in our community. And then we're also going to continue to enhance our collection of socio-demographic data to improve our ability to dive deep into the data and address any equity gaps.
Yeah. I would say the thing that I'm most excited about is really to continue to dive into co-creating solutions together with parents and professionals. Now we've got all this rich data from Unitas, from our healthcare system. We also are partners in the Premier Perinatal Collaborative, which has been really helpful to look at some of the outcomes, maternal and infant outcomes here specifically. And I want to continue to work with our partners to learn from them. They all have such great knowledge, and together with everybody at the table, we're able to come up with those creative solutions. I just, again, have to give credit to those incredible professionals and parents that have helped us build and create this. Sarasota Memorial is the backbone organization, has provided so much strength. But the beauty and what I consider the pulse of First 1,000 Days are our partners.
If I can add to that, Amanda, and I'm kind of looking through some of the questions I see. First of all, let me just take a step back. There is absolutely no question that when we first started this, I felt like we were trying to solve world hunger. And I had no idea how to go about this when we first, started with our partners. One of the questions is if you don't have an FTE. We didn't have an FTE to start. What we did was we had a group of very passionate people that came together from the hospital, Mary and I, and partners in the community. And for a while, I would tell you that a lot of this was a big part of Mary's job. Did she have other parts of her job? 1,000%. Was she still passionate about doing it? You bet. And Mary and I are both two of those people that don't like to take no for an answer and can really say, oh, really? Well, let's see how we could find a solution. I would absolutely tell you that think of philanthropy. We have such a well-respected CEO of the Barancic Foundation. We are very lucky. Again, relate, don't compare. You may say, well, we don't have that. We don't have the luxury. I get that, but you might. You might want to start looking for that or really see what is out there. There was so much out there that we didn't know that Sarasota had. And what we really said was, wow, we've got all the pieces. We just need to figure out how to put them all together. And again, that's what Unitas did for us. We all had other jobs. We started, just because, again, of the passion that we all had for this. I guess what I would say is find out who is very passionate about this, who really wants to come to the table and say, wow, we can do this, we can help you with that. And it just evolved, because there is no way 2018 that we had this figured out, even the structure. And I would highly recommend get that from us, or look at it, benchmark with us. From, like Chelsea said, it took us a while to navigate all that and look at it. But I think our model now is one that works really well for us. It might not for your community, but it's certainly something to look at, instead of trying to make something out of nothing, if you will. Look at other models. There's also a question around the SDOH screening questions. Let me be the first one to tell you, as an executive director in the nursing division, that was very sensitive. And for the nurses on the call, oh, now we're going to give the nurses one more thing to do. Is anybody thinking that? Believe me, I was there too. But I think you have to figure that out in your organization. Every organization's different, but what makes sense in yours and in ours, after a lot of discussion, a lot of collaboration, a lot of partnering, we came up with what made the most sense for us. And yes, there was education around that for our nurses. Mary can share all that with you. The other question that I saw is, were we concerned about sending too many referrals that community partners couldn't keep up? And I think what we've found is that they were able to, and if they weren't, they raised their hand, and we've tried to help facilitate, what do you guys need? I think Chelsea did a great job, Dr. Arnold, of describing that the care coordinators and how they are such a, I don't know what the word is, the entry point, or kind of the place that we are always looking to help all of our partners. So I rambled too much. Sorry. Go ahead with questions or
No,
anything.
that was fantastic, actually, because we were able to get through a number of audience questions. So that's great. And I think we have 4 more minutes left. So I'm going to say maybe we have time for one more, and then we'll turn it over to Kayla to wrap it up. One of the questions that came in from the audience is, how can these strategies that we've been talking about today be applied to small critical access hospitals? Chelsea, Mary, I don't know if one of you would like to take that.
Yeah. I think that in the smaller areas, it is challenging for potentially lack of resources out there to support. I think, like Pam said, go out because you don't know who is out there. I think for the data collection inside the hospital and that kind of the organizational lift of doing what's required for the new mandates. Try and make it as light of a lift as possible. Try and identify the workforce that's already doing some of this work, obviously. Insert it into that so that you're not adding extra FTEs. We haven't added extra FTEs at the hospital in order to do all of the screening and collecting of information and sending the referrals.
I also think leaning on community partners, what we found is we serve a county that is under-resourced, but bringing that data to local foundations, sharing that information with other community partner organizations, they may decide that they want to expand to help that area or that rural community. Again, the strength of partnerships, building those partnerships and coming up with really creative solutions together. The healthcare system and the hospital can't do it all. With the right partners at the table, you can come up with some really innovative ideas, and that's what we've been able to do here.
I think just to end, and I know we've got 2 minutes, but just to add to that question, I've worked with some critical access hospitals, and my argument would be, more than anything, Unite Us is a platform that will really help you with those limited resources. Sometimes there's government funding, most times there is. How can you kind of look at that differently? But just to end, if you haven't heard this enough, partnerships, and collaboration, collaboration, collaboration. What we've been able to do through this initiative with Unite Us just accelerated everything we had begun. And Unite Us was just a way of bringing everything in. And again, the best word I can use is accelerating the results. Very exciting stuff. I've said this 100 times. It's probably the most exciting work I've ever been involved with. And I've been in healthcare for a very long time. The benefits are amazing.
Thank you, Pam. That's a fantastic note to end on. Kayla, I will hand it over to you.
Thanks, Amanda. And that concludes the time we have for today. I'd like to thank our moderator and panel for their time and excellent presentation. And thank you to our sponsor, Unite Us. To learn more about the content presented today, please check out the resource section on your webinar console and complete the post-webinar survey. In the next few days, all attendees will receive an email that will include a link to the archived webinar session. Thanks again for joining us. Have a great day.
Thank you.
Thank you, ladies and gentlemen. This concludes today's presentation. You may now disconnect.